Go ahead.
Good afternoon, everyone. Today we are going to discuss color vision testing. Is online smartphone app an alternative to traditional Ishihara handbook? The assessment of chromatic discrimination ability and the diagnosis of any perceptual efficiency is color vision testing. It's a part of functional assessment of all the visual system by ophthalmologists. With the technological advancement, digital versions of commonly used color vision tests like Ishihara tests have now become accessible to the general public via online platforms. There are three cone receptors that lead to color vision: red, green and blue. Not all people possess trichromacy. Some are partially color deficient or completely colorblind. The most common form of color deficiency is red-green color deficiency. There can be protanopia, protanomaly, deuteranopia or deuteranomaly. Acquired color vision deficiencies may be seen in certain pathological conditions such as cataract and glaucoma. Color deficiency may be caused by ocular disease, trauma or medication, as well as normal physiological process such as aging. The Ishihara test is a color perception test for red-green color deficiencies, and the first in class of successful color vision tests called pseudo-isochromatic plates. There are introductory plates, transformation plates, vanishing plates, hidden digit plates, diagnostic classification plates, tracing and pathway plates. With advancement in smartphone technology and medical software applications, we are increasingly incorporating smartphone applications. These are affordable and accessible, prevent delays in patient care while providers search for Ishihara handbook, solve the problem of shifting colorimetric values with the aging of physical color plates, and interprets its result by differentiating between color deficient and color normal. However, it is unable to classify the type of proton or deuteron of color vision deficiencies on its own. We did random observational studies with 120 participants of 18 to 30 years of age visiting the outpatient department. Informed consent was taken, visual acuities were assessed, ophthalmological assessment was done, and the testing procedure was carried out under standardized conditions for both the Ishihara and the smartphone app. The criteria for any participant to pass or fail was standard for the 38-plate Ishihara test, where 9 errors or more categorized as a participant as having red-green color deficiency and failing the test. Based on these results, participants were grouped as being color normal or color deficient. 52.5% were male, 47.5% were female. 4 out of 63 men were color deficient, while all women were found to be normal. The overall prevalence of color deficiency was found to be 3.3% for the sampled population. The sensitivity was the ability of the test to detect all individuals who had red-green color vision defect, and specificity was to detect who do not have any color vision defect. The sensitivity and specificity of digital version was both found to be 100%. The Ishihara handbook was used as the standard for comparison. The various responses from 4 men who failed screening test on the digital version was recorded. Minimum difference was seen on plate 7, 10, 17, 10 to 17 and 22 to 25. Most significant difference was seen between 18 to 21 plates. The digital version successfully differentiated the color vision deficient from the normal person, however, was unable to accurately detect the extent of deficiency. This may be because the identical depiction of slides of handbook was not possible, as these are scanned of graphic nature of the digital slides in the app. Combined sensitivity and specificity of the digital version and the Ishihara were 100% and 100% respectively. And a combined sensitivity of the digital version of Ishihara test makes it efficient screening tool to detect red-green color vision deficiencies. Birch has a similar test with 401 participants, and it also found out that the red-green color deficiencies was found similar with the Ishihara handbook and the smartphone app. We have several studies like Gundon et al., Gantley et al., Hoffman and Mazzoni, Rodriguez, Cameron et al. They have tested with projected color slides, and they have proved that it is an effective and time-saving method. The digital smartphone application version of Ishihara's handbook is possible alternative to screening for color deficiencies in unavailability of the traditional handbook, and also provides a convenient self-screening alternative to in-office assessments or when test is required to be done by untrained personals. However, it has limitation as it is not able to accurately detect the severity of the deficiency. In case of participants who are positively identified as having color deficiency, a thorough in-office assessment is required to be carried out by an appropriately educated professional using the traditional Ishihara handbook in standardized conditions. Thank you.
Thank you.
Thank you.